Hey, this is Dr. Ben Tindal. I'm a prosthodontist in Sarasota, Florida, and today I wanted to share with you a clinical tip on a common problem in a prosthodontic office or restorative dental practice. How do we create lifelike restorations utilizing modern porcelains despite there being challenges with the underlying either tooth structure or implant component structure if the tooth is missing? Well, as you can see in this first case, we have a traumatized central incisor. Certainly that's a situation where I have to remove more tooth structure to create more space to allow us to mask out that tooth. Here's another case where you can see we had a fractured central incisor and we had a very traumatized central incisor. You can see the difference in the amount of tooth structure I have to remove to create lifelike restorations. The problem that I'm going to talk about today is how do we deal with implant components when they're showing through. Here's a case, as you can see, we're dealing with facially placed dental implants that are shallow, and I'm trying to create a screw-retained restoration that is lifelike and it restores form and function for this patient. Unfortunately, we're seeing through these canines here this graying of the titanium. Titanium is naturally a gray or silver color, and unfortunately under these modern ceramics it can create this graying or shadow effect. So how did I manage that? Well, I used anodizing. Anodizing, as you can see here, is a pretty simple process. I'm simply running voltage through the titanium in an electrolyte solution, and that creates an oxide layer. The thickness of that oxide layer affects the refraction of light and therefore the perceived color of that restoration. The great thing is that there's research to say that this decreases bacterial adherence and ultimately leads to happier gum tissue. Once I completed this nitride process, which is very quick, I replaced these components in the mouth. We replaced the printed prosthesis with a new print with some changes in the anatomy. Certainly I can see some things we're going to tweak from here. But this solved one major challenge I had with her case. She's certainly happy now not seeing that gray show through, and now we can move on to the final form and function of these restorations and complete her smile.